The chance a deal will be worked out there. South Carolina Republican Senator Jim DeMint joining us now. Senator, last week you said defeating health care would be President Obama's Waterloo. Of course, he made reference to that in his press conference. Do you still believe that defeat will happen?
Well, we don't want to defeat health care reform. We just want to defeat a government takeover. And you just heard Congressman Kucinich tell the truth about what the Democrats really want. They want to eliminate private insurance and move to a single payer. They may do it incrementally with co-ops or whatever they're calling it now, but their goal is to move to a government-run healthcare system. But we don't need to replace what's working with what's not working. And that's what we're trying to do as Republicans. The bill, the ObamaCare they're talking about, does not fix anything that's hurting the private insurance market now. It doesn't allow interstate competition. It doesn't allow tax fairness for people who don't get their health insurance at work. And it doesn't fix the lawsuit abuse that's happening. What's going to happen in the Senate is we're not going to have a vote on anything, even in committee, before we leave next week. We're going to do everything we can to let people across the country know what's really in the bills that have been brought out. So hopefully when we come back in September, the president will stop on this government takeover and work with us on some real reforms that helps people get insured.
Senator DeMint, with all due respect, I'm quite sure that Representative Kucinich and his single-payer party idea is not what President Obama has talked about. In fact, President Obama has been very clear that he doesn't want to eliminate private insurance. He just wants to make sure that there are certain restrictions and caps, which, frankly, you have very smart people who have followed healthcare before saying that when you refuse to allow somebody to buy insurance because of pre-existing conditions, that becomes a problem. Now, if you were able to put a cap on that and only do it by age, then you start getting a lot more people insured with private insurance. This is not throwing down the gauntlet against private insurers. That's what the president says. So are you calling the president a liar or disingenuous? Because that's not what he has said.
I know what the president said, but the Lewin Group has looked at his plan and said at least 80 million Americans will lose their private insurance. I worked in health care for 15 years before I came to Congress. I ran my own business. I know a lot about what we're talking about here, and what's going to happen as we expand government plans will be more cost shifting to the private plans to the point that they'll no longer be offered. We are for fixing the system. I introduced the Healthcare Freedom Act just a few weeks ago that provides block grants to states to provide insurance for those who have pre-existing conditions. We need every American insured with a private policy. But the things the president is talking about will not do that. They're going to create fanny meds in every state instead of allowing interstate competition. I mean, some of the answers here are obvious. Right now we have a state-by-state monopoly of insurance companies. The president won't allow interstate competition. That would mean dozens and dozens of companies were competing for our business. Instead, he wants a government plan that's subsidized to compete with private insurance. It makes no sense at all.
Senator, let's talk about this gang of six negotiation, as we've called them, the three Republicans, three Democrats. One of the things that kind of turned the country around on health care in the past couple of weeks is seeing the process take place in the House of Representatives of negotiation. The more they saw the details of the plan, the more they disliked it. Whereas this gang of six is essentially operating behind closed doors, kind of like the way the Hillary Care did back in the early 90s. Is there any attempt on the part of some, like you, for example, to make it more transparent, to allow the public to look in and see what they're doing?
Well, we're finding out bits and pieces about what's going on, and I applaud my Republican colleagues and my Democrat colleagues trying to work together on some principles. But the problem is we have polar opposite views. One is we want more government control on the Democrat side. The Republicans would like to employ some of these policies that would make private insurance work for those who are not insured today. We don't want to take any insurance away from people or affect Medicare, but it's hard to bring these two sides together when the clear goal of the Democrats is more government control. And now I'm not just saying that as a partisan. Obama voted against everything that was brought up when he was...
But transparency, Senator, forgive me for interrupting. You're not answering the question. What about transparency? Can you demand that the public have a right to look in and see what this collection of senators are doing?
Well, we certainly will demand it, and if any plan comes out, we're going to get it on the internet as soon as we can, just like we've done the other bill that came out of the Help Committee here on the Senate side and the bill that will come out of the House. If Americans know what's in this bill, they will not support it.
Well, that's half the battle. Let us know what's in it. All right, Senator, thank you very much.
The Obama administration